Okay, so I get asked a lot, what's the difference between acupuncture with an acupuncturist and acupuncture with a physiotherapist, an osteopath, a chiropractor, my doctor? How is it all different then? Because I've had people, I'll say, have you had acupuncture? And they go, yeah, but it didn't work. And I say, was it with an acupuncturist? Well, yeah. Well, no. With my physio, my sports therapist, my chiropractor, my nurse, my doctor, and I'll go, it's not the same. So you're not going to get the same results. And they go, but they called it acupuncture. And this actually really tends to annoy a lot of acupuncturists because they call it acupuncture and it isn't acupuncture. It is a form of needle therapy and it has its own name. So depending on which one of them are offering it will depend what they call it. So most of your sports therapists, physiotherapists and musculoskeletal therapists will tend to call it trigger point therapy. If they do it on a couple of day course with the doctors, the nurses, the midwives, things like that, they call it Western medical acupuncture. Another one that acupuncturists tend to call it is dry needling, and it is well known as dry needling because it's not following meridian or any acupuncture nerves. And it's also known as Arshi, which is a Chinese thing, and this is what the acupuncturists will call. So again, the question is, why are these names? Well, we're not annoyed that other therapists do acupuncture, but what I would like them to do is call it what it is. If they said to you, I'm going to do some trigger point therapy with you, I'm going to do some dry needling with you, I'm going to do some Western medical acupuncture with you, you would then know the difference between what you are being offered to what you have now and things like that. It's the difference like saying, I'm going to offer you an apple and call it an orange. And you then come to me and I say, do you like apples? And you go, no. So I then give you an actual apple and you go, well, that's not an apple, that's an orange. And you go, no, that's an apple. I don't know if I made that sense, but basically, if you're going to call it acupuncture, then it better bloody be acupuncture with yin yang qi and an acupuncturist that's trained for 3 years minimum full-time degree. And if it's not that you've trained 3 years full-time degree in Chinese medicine, whether that is 5 element, whether that is Dong acupuncture, whether that's traditional Chinese medicine, whether that's Japanese acupuncture, and you see there's so many different types. If it's that and you've trained in that, fantastic. But if it's not that and it's using just the muscle system and you're not actually using acupuncture points, you're using the muscles, please call it what it is to patients so they don't get confused. Anyway, call an apple, an orange. They are all fruit, but they have the right names for a reason. This has been Thoughts with Points and I hope it helps with some of the confusion. Take care.